You know the exact feeling. You're just sitting there on the couch.
Right.
Maybe you're binge watching a show, or you're finally lying in bed just staring at the ceiling, letting the day wash off you,
Yeah.
and then out of nowhere you feel it.
Just this tiny, like almost imperceptible tickle.
Yeah, a phantom itch. Or sometimes it's the undeniable absolute certainty that tiny ants are marching in a straight line right up your calf.
Oh, it's the worst.
So you swat at it, you throw the blankets back, you literally turn on the flashlight on your phone and intensely inspect your skin,
Yeah.
and there's just nothing. Bare skin.
It's deeply unsettling because it directly challenges your trust in your own senses, you know. Your brain is sounding an alarm for an intruder that simply does not exist.
You genuinely start wondering if you're losing your mind.
Yeah.
But I mean, you are not. There is an actual clinical medical term for this exact sensation of insects crawling on or under your skin.
Yeah, it's called formication.
Exactly. So today, we are taking a deep dive into the source material. We've pulled from a massive stack of clinical guidelines, neurological research papers, dermatology journals, and expert medical articles.
It's a really comprehensive stack.
It is. And our mission for this deep dive is to decode what causes this sensation of insects crawling under your skin.
Huh.
We're going to find out what causes the nervous system to misfire like this and what can actually be done to stop it.
What's fascinating here is that to understand this, we have to look far past the surface of the skin. Like, we really have to map the entire communication network of the human body.
Okay, let's unpack this. Before we get into the bugs that aren't there, we need to establish a baseline.
Right? The baseline itch.
Yeah. What is the mechanical difference between a normal, everyday itch from, say, a mosquito and this totally bizarre phenomenon of formication?
So formication is classified clinically as a type of paresthesia. More specifically, it's a tactile hallucination.
Hallucination is a heavy word.
It is, and it often carries a psychiatric stigma. But neurologically speaking, it just means the physical sensation you're experiencing is 100% real in terms of brain activity. There just isn't a corresponding physical trigger in the outside world.
So the brain is running the itch program, but nobody clicked the icon.
That is a great way to put it. To see how that happens, you have to look at a normal itch. When a mosquito bites you, chemical mediators trigger specialized receptors in your skin. They're called pruriceptors.
Pruripeptus, got it.
And that signal is then loaded onto specific nerve endings called unmyelinated C fibers.
Hold on, let me stop you right there. Unmyelinated. What does lacking myelin actually mean for how this nerve functions?
Well, myelin is like the rubber insulation around an electrical wire. It helps signals travel incredibly fast.
Okay.
But C fibers do not have that insulation. They're very slow conducting fibers. They carry dull, aching pain, heat, and itch.
So it's a slow burn.
Exactly. They slowly transmit that itch signal from your skin to a cluster of nerve cells near your spine called the dorsal root ganglion. And from there, the signal enters the spinal cord, arriving at two specific regions in the gray matter called lamina I and lamina II.
Wait, what happens in lamina I and II? Are they just like passing the baton up the chain?
Not exactly. They act more like bouncers at a nightclub.
Oh, I love that.
Yeah, these regions are packed with interneurons that basically decide whether this sensory signal is important enough to send up to the brain or if it should just be suppressed.
So the bouncers check the ID of the itch.
Right, and if the bouncers let it through, the signal travels up the spinal tract and hits the thalamus, which is your brain's primary sensory relay station. But it also hits the parabrachial nucleus.
And what does the parabrachial nucleus do in this whole relay?
That is the emotional center of the itch.
Wow, an emotional center for itching.
Yeah, it's the part of the brain that takes a simple physical sensation and attaches that intense, urgent, agonizing feeling of needing to scratch immediately.
This is so wild. I really love mapping it out like this. It really is like a home security system.
Yeah, it really is.
Like a normal itch, the mosquito, is someone physically breaking a window. The sensor detects the broken glass, triggers the alarm, the bouncers let the signal through, and the monitoring center in the brain panics.
Exactly.
But formication, this phantom itch we're talking about, is a mechanical failure. The window is perfectly fine, no one is breaking in, but a glitch somewhere in the wiring itself is causing the monitoring center to scream that there is an intruder.
Right. The wiring is just firing spontaneously.
Which really begs the question, if the wiring is glitching, what is actually damaging or altering these wires to cause the misfire in the first place? I mean, wires in a healthy body don't usually just short out.
No, they don't. And that leads us to the most prevalent yet surprisingly least discussed culprit in the medical literature.
Which is?
We are talking about massive hormonal shifts, specifically the intense fluctuations that occur during perimenopause and menopause.
Oh, wow. Yeah, the statistics and the research on this are actually staggering. Up to 20% of women in midlife experience this crawling sensation.
It's a huge number of people.
It is, and the sources point directly to the sudden lack of estrogen. During perimenopause, a woman's estradiol levels can plummet from a healthy, 300 or 400 picograms per milliliter down to under 15.
Which is a massive shock to the system.
It's a 90% drop. But I guess my question is, why does a reproductive hormone crashing cause a sensory nerve to hallucinate bugs?
Well, categorizing estrogen purely as a reproductive hormone is actually a massive oversimplification in modern medicine.
Really?
Oh, yeah. Estrogen is foundational for the central nervous system. It acts as a powerful neuroprotectant. It directly stimulates two crucial proteins, nerve growth factor, or NGF, and brain-derived neurotrophic factor, BDNF.
So these proteins are essentially like fertilizer for your nerve endings.
That's a perfect way to look at it. They provide structural integrity, they keep the nerve endings robust, they facilitate repair, and they maintain the normal threshold for firing.
So they keep the nerves calm and stable.
Exactly. But when estrogen plummets, that chemical support system just vanishes. The nerve endings literally become unstable. Their threshold for firing drops dangerously low.
The sources describe these unsupported nerves in a way that really stuck with me.
Oh, the drama queen analogy.
Yes. Because they are deprived of their usual chemical signaling, they become hyperreactive drama queens. They are basically bored, starved for input, and highly unstable.
So they just make things up.
Right. They start fabricating sensations like phantom bugs just to get the brain's attention.
And a stimulus that a healthy nerve would completely ignore, like the ambient air in the room, a change in humidity, or just the light friction of a bed sheet, is suddenly amplified by these unstable nerves into a major sensory crisis.
So the nerves are screaming intruder
Right.
when it's just like a shadow passing over the window.
Precisely. And the problem compounds because the environment surrounding those nerves is deteriorating at the exact same time. The structural changes in the body amplify those phantom signals.
Because the skin itself is a barrier, and that barrier is breaking down.
Right. A steep drop in estrogen triggers a rapid loss of collagen and hyaluronic acid. Women can lose up to 30% of their skin collagen in the first 5 years of menopause alone.
30%.
Yeah.
That is wild.
Yeah, the skin physically thins out, it loses its moisture retention, and it becomes significantly less elastic.
So those hyperreactive drama queen nerves are now physically closer to the surface of the skin. They have way less padding.
They are far more exposed to the elements. And add to that a massive immune response. Estrogen plays a huge role in stabilizing mast cells.
Remind us what mast cells do again.
Mast cells are the immune cells responsible for releasing histamine, which is the chemical mediator that causes itching and inflammation. Without estrogen acting as a stabilizer, these mast cells become highly volatile.
So they just start firing off for no reason.
Pretty much. They begin degranulating, which means dumping histamine into the surrounding tissue at the absolute slightest provocation.
Now, the research also mentioned a gut enzyme called DAO, which usually cleans up excess histamine. Why does that enzyme suddenly stop doing its job during this same period?
Well, estrogen dictates the health of the mucosal lining in your gut, which is where DAO is primarily produced.
Ah, so it's all connected.
Everything is connected. When estrogen dips, the gut microbiome shifts, the mucosal lining weakens, and DAO production just stalls.
So you have a volatile immune system dumping excess histamine and a compromised gut failing to clear it away.
Exactly. The histamine just pools around those exposed, unstable nerve endings.
Here's where it gets really interesting. If you combine all these physiological changes, it perfectly explains a detail that drives sufferers completely up the wall.
You mean why it happens at night?
Yes. Why formication is almost always worse at night.
The nighttime exacerbation is an absolute hallmark of the condition.
Let's layer it all together based on the sources. At night, the human body naturally drops its core temperature to initiate sleep, right?
Right, that's standard circadian biology.
But if you are going through perimenopause, your vasomotor system is also glitching, causing night sweats and rapid hot and cold flashes.
Which is chaotic for the skin.
Totally. Furthermore, the stress hormone, cortisol, often spikes in the evening for women in midlife due to circadian rhythm disruptions.
So they are stressed, hot, cold, and itchy all at once.
Exactly. So you have a person trying to sleep, their skin is soaked in excess histamine, their nervous system is on high alert from the cortisol spike, and suddenly they are subjected to a roller coaster of extreme temperature changes.
Those exposed nerve endings are absolutely going to misfire.
It's the perfect physiological recipe for a hallucinated itch, precisely when you just need to rest.
The sensory gates are basically thrown wide open just as the external distractions of the day fade away. It leaves the brain with nothing to do but obsess over every single faulty signal coming from the skin.
It sounds like absolute torture. But
Yeah.
let's say your hormones are perfectly balanced, like you aren't in menopause. Why would the alarms still go off? To figure that out, we have to trace the wire from the skin back to the spine.
If we connect this to the bigger picture, neuropathic itch can originate from a mechanical impingement anywhere along that neural pathway.
So the skin can be totally fine.
The skin can be flawless, the hormones can be perfect, but if the wire is physically pinched, the brain still registers an itch.
Give me an example of how a spinal pinch translates to a skin itch. Like, how does that work?
Well, consider a condition called notalgia paresthetica.
Notalgia paresthetica.
Okay. Patients with this report a maddening, completely unreachable itch right under their shoulder blade. They scrub it, they put creams on it, and nothing works.
Because the problem isn't the skin at all.
Exactly. The problem is a bulging disc or severe muscle tension compressing the nerves exiting the spine at the T2 to T6 vertebrae in the upper back.
Oh, wow.
The brain receives the distress signal from that pinched nerve root and projects the sensation outward, basically mapping it to the skin of the shoulder blade.
Now, if you are listening to this right now, hunched over your laptop or staring down at your phone, you really need to hear this next one. Because your posture could literally be causing phantom bugs.
Yes, you are referring to brachioradial pruritus.
Right.
This condition presents as an intense itching, stinging, or crawling sensation on the forearms. But it is highly correlated with cervical spine degeneration.
Meaning the neck.
Specifically, damage or impingement at the C5 to C8 vertebrae in the neck, tech neck, or chronic forward head posture, physically compresses those exact cervical nerves.
So your neck takes the mechanical damage from looking at your phone, but your brain hallucinates the itch on your forearms. That is incredible.
It's a classic referral pattern.
The sources mentioned an incredibly clever diagnostic trick for this too, called the ice pack sign. How does putting ice on your arm prove the problem is actually in your neck?
It relies on the gate control theory of pain. Cold sensations travel along different heavily myelinated nerve fibers. Those are the fast wires we talked about earlier.
The ones with the rubber insulation.
Exactly. But itch signals, as we discussed, travel on the slow, unmyelinated C fibers. So if you put an ice pack on the itchy forearm, the intense cold signal races up the arm, hits the spinal cord, and essentially slams the gate shut before the slow itch signal can even get through to the brain.
The fast wire beats the slow wire to the bouncers at the club.
That's exactly it. If ice instantly relieves the itch without treating the skin itself, a doctor immediately knows it is a neuropathic transmission issue, likely stemming from the cervical spine.
That is such a smart diagnostic tool. But impingement isn't the only way to damage the wire, right? What about viral damage? The sources talk heavily about shingles.
The varicella zoster virus, which is the virus that causes shingles, is notorious for this. Long after the visible rash is healed, the virus can leave behind profound structural damage to the peripheral nerves.
What kind of damage?
It can literally strip away the protective insulation of the nerves in a specific region.
Oh, so it's like a frayed phone charger cable. The rubber is stripped away, and the exposed wires are just sparking against the carpet, sending random electrical discharges.
That is the exact mechanism of post-herpetic formication. Those ectopic discharges cause severe chronic crawling sensations in the exact band of skin where the rash used to be.
Even though the skin looks totally healed.
Right. Furthermore, metabolic issues can cause similar fraying. Small fiber neuropathy, which is often triggered by diabetes or severe vitamin B12 deficiencies, causes those unmyelinated C fibers to slowly die off.
And as they die, they glitch.
Yes. As they degrade, they send chaotic, aberrant signals, usually starting in the hands and feet.
Okay, so we've covered the sensors in the skin, we've covered the wires in the spine. But what happens when the wires in the skin are perfectly healthy and the monitoring center itself, the brain, hallucinates the intruder?
The clinical literature contains rare but profound examples of this. The most striking is delusional parasitosis, sometimes called Ekbom's syndrome.
Right, Ekbom syndrome.
And this can be triggered by a cerebral infarct, a stroke. Specifically, a stroke localized in the right medial occipital lobe of the brain.
Wait, the occipital lobe is in the back of the head, right? It processes vision. How does a stroke in the visual center cause you to feel bugs on your skin?
It's fascinating. The occipital lobe doesn't just process raw visual data. It integrates with adjacent regions to map your body in physical space.
Okay, so it helps you know where you are in the room.
Right. If a stroke damages the neural circuit responsible for spatial mapping, the brain receives a mismatch in data. The somatosensory cortex says, hey, I feel something, but the damaged visual spatial map cannot correctly identify what or where it is.
It gets confused.
The brain is functioning as a prediction machine. It tries to resolve the conflicting data and logically concludes, if I feel a sensation moving across my skin, but I cannot correctly map an external object, I must be infested with parasites.
That is terrifying. The physical structure of the brain forces a reality onto the patient that is inescapable.
It is entirely real to them.
So what does this all mean for you? If you are the person swatting at invisible bugs, how do you find relief when the root causes range from a severed visual spatial network to a vitamin deficiency?
Well, the cornerstone of management is acknowledging that standard anti-itch creams will never, ever solve a structural or chemical neurological glitch. You have to match the intervention to the root cause.
Let's break those down. For the vast majority dealing with hormonal formication, what is the clinical protocol?
Restoring the lost estrogen is often the definitive off switch. Bioidentical hormone replacement therapy, or HRT, directly replenishes the central nervous system support.
So it brings back the fertilizer.
Exactly. It turns back on the production of nerve growth factor, it restabilizes the mast cells, and it thickens the skin barrier.
Yeah.
Once the environment is restored, the nerves raise their firing threshold back to normal and finally quiet down.
But the research also highlighted targeted nutritional interventions for those who, maybe cannot use HRT.
Yes, high-dose vitamin B complex is critical, as B vitamins are the essential building blocks of nerve repair. Omega-3 fatty acids are also utilized to aggressively lower systemic inflammation and repair the lipid barrier of the skin.
There was also that herbal extract mentioned in the trials.
Right. There is very compelling clinical trial data surrounding a specific herbal formulation called Ester G100. It actually demonstrated a 58% reduction in paresthesia and tingling in participants.
Wow, almost 60%.
Yeah, offering a really potent non-hormonal pathway to stabilize the nerves.
What about the mechanical misfires? The pinched nerves in the neck or the vibral damage from shingles? Obviously, estrogen isn't going to fix a bulging disc.
No, it won't. In those cases, physicians often utilize medications that alter the electrical activity of the nervous system. Gabapentin is frequently prescribed off-label for formication.
How does gabapentin stop the itch?
It works by binding to calcium channels in the nerves. This effectively restricts the flow of electricity and dampens the hyperreactive firing.
It basically puts a speed bump on the wire.
That's a good analogy. Alternatively, older, sedating antihistamines like chlorpheniramine are sometimes used at night. They block the histamine receptors while simultaneously forcing the central nervous system into a relaxed state. It bypasses the erratic signaling so the patient can actually get some sleep.
There are also some immediate environmental changes you can make to stop antagonizing these nerves right now.
Yes, absolutely.
If your skin barrier is thinning, washing with harsh, heavily fragrant soaps is destroying what little protection those nerves have left.
It's the worst thing you can do.
The sources emphasize aggressively rebuilding the skin barrier using creams packed with ceramides. Ceramides are the natural lipids that hold skin cells together and ditch the tight synthetic athletic wear.
Right. Friction and trapped heat are the absolute enemy of an unstable nerve. Wear loose, breathable cotton or silk.
And what about stress?
Lowering systemic cortisol through active stress reduction is a tangible biological intervention. High cortisol literally lowers the firing threshold of every nerve in your body.
So let's synthesize everything we've uncovered today. Formication, the sensation of insects crawling on or under your skin, is not a psychiatric failing.
Not at all.
It is a highly specific physical symptom of a nervous system that is misfiring. Whether that glitch is caused by a 90% drop in estrogen stripping away nerve fertilizer, a compressed cervical nerve from tech neck posture, a frayed wire from a past virus, or even a spatial mapping error in the brain itself, the mechanism is completely physiological.
And this raises an important question. How do you advocate for yourself?
Because the medical system often dismisses invisible sensations.
They do. But when you understand the specific mechanical pathways we discussed today, it completely removes the panic. You can walk into a doctor's office and confidently ask for a cervical spine evaluation or a full hormone panel rather than just accepting another useless tube of hydrocortisone cream.
It is all about fixing the underlying wiring. But before we wrap up this deep dive, I want to leave you with one final, deeply provocative concept from the neurological research.
Oh, the scratching loop.
Yes. It has to do with what happens when you try to scratch the phantom bugs away.
Because scratching an itch provides temporary relief, but it triggers a really complex cascade in the brain.
The physical act of scratching activates the ventral tegmental area. That is the brain's core reward and reinforcement center. It releases a massive flood of dopamine.
Your brain literally rewards you for scratching.
So here's the thought to ponder. If you suffer from a chronic neuropathic itch, and you scratch it day after day, month after month, the dopamine is constantly reinforcing that neural pathway. Could you accidentally rewire your brain's circuitry?
Scary thought.
Could you create a permanent puroplastic loop where the brain becomes so addicted to the dopamine reward that it permanently forgets how to turn off the itch, even long after your hormones are balanced or your pinched nerve is perfectly healed?
Neuroplasticity allows the brain to heal, but it also allows the brain to learn a pathology so deeply that it becomes a permanent feature of your sensory reality.
So the next time you are lying in bed and you feel that undeniable tickle of a tiny ant marching up your leg. Wait, no, let's just say before you scratch, take a breath.
Just pause.
Remember the complex network of bouncers, wires, and hormones firing beneath your skin, and maybe, just maybe, let the alarm ring until you can fix the wiring.